my name is Dr. LeBauer from LeBauer Physical Therapy, and today I'm going to talk to you about using the Ready State's Gemini. This is a self-massage mobility tool from the Ready State, or formerly Mobility Watt, that you can use for a lot of different things on your body to improve your mobility. Right now, I'm going to show you how to use the Gemini to improve your shoulder mobility, specifically in your rotator cuff. I was talking to my friend Kelly Stret from the Ready State, messaging him through Instagram. He said he loves it for your upper back, cervical, thoracic area, and I've tried that and I love it. But I've also found that I can use it for my rotator cuff and shoulder mobility. So I want to show you about that today. This is a really hard, firm tool. So if your body is really skin sensitive, it might be a little too much, but I think for a lot of you, you're going to love this. So a few things before we get into it. There's a couple ways this works. Number one, if a tool like the Gemini, or say the rumble roller, or a ball, or a lacrosse ball, it helps you move and feel better, that's awesome. That's really great. I'd love to know. Comment below. If that happens, that means skilled physical therapy with a doctor of physical therapy who understands lifting, moving, mobility, pain, and injury can even help you, or can only help you get even stronger, better, and faster and hit the next PR, or just be able to play with the kids even more. The other thing that I want you to know is there's an option that this changes nothing, and that's okay. Maybe it makes it feel a little worse or irritable. And what that means is that, not that it doesn't work, it just means it might be the wrong tool, or you might be looking in the wrong area of your body to solve the problem, and that's when you really need to speak with a doctor of physical therapy whose expertise in the body and pain and whatever activity that you want to be doing instead. So I used to race bicycles, I know I swing kettlebells, so and I've done CrossFit. So those kinds of movements, like I understand really well. So the therapists in our facility, and maybe you're a rock climber or something, or doing something else. Look for someone that understands your movement and your activity, and it's not going to tell you to stop and never do it again. They're going to empower you to find ways to continue doing what you love. Also, if you're new to our channel, or you're watching this for the first time, I'd love it if you subscribe and hit the notification bell so you can get access to more of our videos. So the Gemini is really awesome. It's got this nice little groove. I mean, so this is great for, spine, bony prominences to go in here, not because it would be harmful, but only because it would be more uncomfortable, because you want to get the trigger points and very tender spots in your muscles on like the rubber surface. So for your shoulder, I'll show you, my shoulders are a little limited going overhead. And this one, I've been working on this already, but it's a little limited, more limited than the right. What I'm going to do is I'm going to lay on my side and work right in these tender areas in my rotator cuff to create a little bit more mobility. A lot of this is also from my lats here. So the way is to do that, take your Gemini, put it on the ground. You can put your head in your hands, and you can, so right now I'm on like the lat, and I found a nice little tender spot right under the shoulder blade. And I can hang out here and breathe. So I'm not going to sit here the whole time, because I want you to try this yourself, but there's a couple different ways to do the techniques. Number one, you're going to just breathe into it, maybe roll back and forth. The other thing you can do is you can stay here for 3 to 5 minutes. Okay, you can also come up into the rotator cuff muscles and find a nice juicy spot. I'm gonna breathe through it. And then sink in, and then it eases up. Sometimes when you hit a really juicy spot, it will refer pain in other areas from your shoulder, up your neck. It may stay irritated during the day, and that's okay. The next thing you need to do is, once you get more mobility in an area, then you want to work on how do we stabilize it. So one of my favorite stabilizations for the shoulder girdle is to take a band, stretch it across, turn your head. And you can do this sitting, standing, laying on your back. If your symptoms are really bad, you're going to do it on your back. If it's moderate, you can do it kneeling, I might be out of the screen here, half kneeling, or even standing. The other ones I love are pretty much anything with, let's see, a kettlebell overhead, press, and a couple versions of windmills. You can do bottoms up presses, work on that overhead position and stability. There's a lot of other ways. If you're unsure about exactly what to be doing next, that's okay. You can check out some of our other videos, but my number one recommendation would be to work with a professional. Working with a professional physical therapist who knows your body is basically the same as working with a coach, whether it's a CrossFit coach, or it's your defensive coordinator when you play football, your head coach, or your coach in basketball. Even having a teacher in school or professor in college, working with a physical therapist can only help you and your body improve your strength, your function, your mobility, your pain levels, and your ability to be stronger, better, and faster. So one of the things we do here at LeBauer Physical Therapy, well, not in my garage, but over at the clinic, is we have an opportunity for any person who's interested or struggling with nagging pain or injury to come in for a free total body diagnostic exam. It's a 20-minute conversation and full body exam and assessment where you'll understand exactly what the root cause of the problem is and where the problem is coming from and exactly what's going on. We'll get an opportunity to understand where you are, what you've tried, what hasn't worked, because a lot of the patients we see have already been to other physical therapists, surgery, injections, chiropractors, massage, even other professionals, and the problem still persists. So we get to understand exactly what that is, where you want to go, and what your goals are, and if we can help you, then we'll create a plan to help you get better, faster, stronger, with less pain, without any additional medications, injections, or surgery. All you gotta do is go to free TBD, like Total Body Diagnostic. It's freetbd.com. And if you're not in North Carolina, we can still help you. So go ahead and click on the link below, and we'd love to chat with you. If you're looking for more videos on how to use the Gemini or Rumble Roller, Theracane bands, check out the rest of our channel. Be sure you subscribe, hit the notification bell, and we'll see you on the next video. Thanks.